This video covers the anatomy of the heart and pericardium, presented by Dr. Vishnu Pal.
Welcome to a comprehensive guide to the heart's external anatomy.
The pericardium is a conical, fibrocerous sac that encloses the heart and the roots of the great vessels. It lies within the middle mediastinum and is related to several posterior structures, including the esophagus and thoracic vertebrae. The functions of the pericardium include protection and shock absorption for the heart, restricting excessive movement, and preventing overexpansion. It minimizes friction and serves as a mechanical barrier against infection spread. This illustration shows a plane of section, identifying the layers of the pericardium, including the fibrous pericardium, serous pericardium layers, and the pericardial cavity surrounding the heart. The pericardium, a conical fibrocerous sac, is divided into the cone-shaped, single-layered fibrous pericardium and the double-layered serous pericardium. The serous layer further splits into the parietal and visceral layers. The fibrous pericardium is the outer, thick, cone-shaped sac. The serous pericardium is the inner, double-layered blind sac, with the parietal layer lining the fibrous pericardium and the visceral layer, or epicardium, covering the heart's outer surface. The fibrous pericardium is a cone-shaped, thick sac of fibrous connective tissue. Its apex blends with the great vessels, and its broad base fuses with the central tendon of the diaphragm. Anteriorly, the fibrous pericardium is connected to the sternum by superior and inferior sternopericardial ligaments. It also protects the heart, keeps it in place, and prevents overdistension. This illustration provides a detailed view of the layers surrounding the heart, from the endocardium to the exterior, highlighting the fibrous and serous pericardium layers. The fibrous pericardium is a single-layered, tough, fibrous sac. Superiorly, the apex blends with the great vessels. It has relations anteriorly, posteriorly, and inferiorly. The serous pericardium is a thin, double-layered sac, lined by mesothelium. The parietal layer is the outer layer, lining the inner surface of the fibrous pericardium. The visceral layer, or epicardium, covers the external surface of the heart and the roots of the great vessels. It is continuous with the parietal layer along the roots of the great blood vessels. The pericardial cavity is the potential space between the parietal and visceral layers of the serous pericardium. It contains about 15 to 20 milliliters of pericardial fluid, which lubricates surfaces and reduces friction. The contents of the pericardium include the heart, the ascending aorta, the pulmonary trunk, the lower half of the superior vena cava, the terminal part of the inferior vena cava, and the terminal part of the pulmonary veins. The fibrous and parietal layers are supplied by branches of the internal thoracic and musculophrenic arteries. The visceral pericardium is supplied by coronary arteries. The fibrous and parietal layers are supplied by somatic phrenic nerves and are pain-sensitive. The visceral pericardium is supplied by autonomic nerves from the sympathetic trunk and vagus nerve and is insensitive to pain. This scene is intentionally left blank for visual transition. The sinuses of the pericardium are communicating zones formed by the reflection of the serous pericardium. They include the transverse sinus, a horizontal passage, and the oblique sinus, a cul-de-sac behind the left atrium. This image illustrates the location of the transverse sinus, allowing a hand to pass behind the ascending aorta and pulmonary trunk. A clinical integration is the significance of the transverse pericardial sinus, which allows temporary ligature in cardiac surgery. Pericarditis, inflammation of the pericardium, can result in pericardial friction rub. This scene is intentionally left blank for visual transition. Pericardial effusion is the accumulation of excessive fluid in the pericardial cavity. This pressure on the heart prevents complete filling of the chambers, leading to symptoms like chest pain. Severe pericardial effusion can lead to a water bottle heart sign on a chest radiograph. Cardiac tamponade is the compression of the heart due to the inelastic nature of the fibrous pericardium, reducing cardiac output. This radiograph visually demonstrates the presentation of pericardial effusion, often referred to as a, quote, water bottle heart sign. This scene is intentionally left blank for visual transition. Pericardiocentesis is the aspiration of fluid from the pericardium. The patient is positioned supine with the head end raised to bring the heart closer to the anterior chest wall. The procedure can be performed using two main approaches. The subxiphoid approach involves inserting a needle at the left costoxiphoid angle. The peristernal route introduces the needle into the left fifth or sixth intercostal space under ultrasound guidance and is the preferred elective procedure. Thank you for watching this video on the anatomy of the heart and pericardium.